Dr. Lieutenant Governor Josh Green on the radio with us. Talk about full circle. I feel like all of us have a weird, strange connection now.
Look, all kidding aside, I'm glad we didn't French kiss on the radio.
Oh, yeah.
Especially me and Fat
Joe. Right.
Yeah.
Next time, bro. Next time.
Yes, anytime. After the pandemic is gone.
Right.
Crap. How are you feeling, guys? How are you guys doing?
Oh, good. I feel fine.
Yeah, I feel
You'll
No
be negative.
symptoms. I'm great.
Yeah. The everybody that I've come into contact with during that brief window has been negative. All of them, with the exception of my 2 staff members who were basically already positive, and I think that's how it started. So
Right.
I just feel badly. This is what happens, though, I guess, during a pandemic. And boy, who would have thought?
Dr. Green, and once again, we're on the line right now with Lieutenant Governor Josh Green via Zoom. I want to clarify something on your behalf and on our behalf, is because I saw this video. It was on a local news station where, she kind of like went into you a little bit, in my opinion, at least the way I viewed it. And she's like, well, why did you take off the mask? And I was like, well, hun, girl, you've never obviously been on the radio. It's like, it is impossible to do any show while wearing a face mask. It's just, between the breathing and the projecting of our voices that we need to do. And with projecting comes a deep inhale, and trying to do that for 15 minutes. I challenge anyone to try and do that. And then, number 2, it was, we were doing a COVID test. I mean, that was the whole premise behind the thing. And the most important thing, you were there to inform the public. You were doing a solid, informing the public on the current state of Hawaii in regards to this pandemic. And it's our duty, as well as, and it's your duty to inform the public using our platform. And you're going out of your way to reach out to various platforms, be it social media, be it radio broadcasting and whatnot, just to help out the Hawaii people. So we thank you. If we could go back and do it all over again, would we? Absolutely, we would. So know that you're family to us. And, if anything, the one thing that I've told everyone to take away from this is look how easily and unknowingly it can be passed. That's the one thing you should get away from that story. But once again, in Josh Green's defense, there is no way you can do a radio show while projecting your voice and trying to inhale after projecting your voice while wearing a face mask. It's just pretty difficult.
Well, thank you for that. And my feeling is what we did was we did our best to socially distance, is to see that we keep 6 feet apart. And again, it's challenging. We have small studios, but you guys do a very good job. You're set up perfectly to separate by 6 feet. And also, you are a family unit. You are essentially what we like to say is, it's not just family, it's your household. You are a household, and I've become a household member with you by coming once a week. That's just the way it's been, and we do our best. But I still feel terribly that anybody would have to deal with anything extra given how hard times are. So I just thank you guys for being so kind and generous with me. It's been quite an extraordinary situation. So I'm particularly grateful that other people didn't get sick. But, I try to share with people, it's part of the business. 20% of all people who have COVID are healthcare providers, because just seeing people, you're seeing patients, and it's fine. It's what it is. It's supposed to be that way, right? So my special love goes out to the nurses out there and the docs out there that are working, and the medics and all these guys out there in the front lines. And then you guys who continue to go to work and continue to, try to inform people and educate people on what's really going on. So it is an unprecedented situation. If we do well by each other and do our best to socially distance, our best to have masks when we're not, we don't have to be vocalizing. Because you're right, when I do my updates daily, I can't wear a mask. No one will hear me. It's impossible. So, and we're going to get through it just fine. But you guys are young, healthy, power people, so you're going to be fine. I'm slightly lamer, so I'm in my 9-year-old's bedroom because of it.
Yeah.
Lieutenant Governor Green, let me correct you. Kimmy's young. She's the only one that's categorized as young.
Yeah, we're up there, kind of.
So if you consider yourself in the lame category, so are Joe and I. Okay? Let's be honest here.
No, you guys are great. I'm doing totally fine. I turned the corner yesterday, I believe. My symptoms, which were mostly fatigue and some aches, have kind of gone away. You can hear my voice a little hoarse, but that's because I've been having meetings on Zoom for the last 5 hours and just getting ready for the program. We're finalizing the details on the travel to Hawaii program, the pre-travel program for safety. I'm now going to be in charge of the eventual vaccination program, which I would love to enlist your help on if people would like. It'll be optional, totally optional. If people would like to get a vaccination once the vaccinations are proven safe, we're going to do that. My goal will be to do it in a 72-hour window if it's possible, to get everybody a vaccination if they can. Lots of ideas and work, will be put into this, but I just want people to be safe, and I want us to somehow get back to a little bit of a regular life, and that's going to come.
Yeah. I wanted to ask you actually about, reopening and everything, because I know that they just approved on Kauai to have the resort bubbles, and just kind of what you're thinking about that, and if there are any other ideas that might, go over to some of the other islands too.
Could very well be. Because we're opening I had someone ask me this question earlier today, because we're opening now on October 15th, it will actually mean that you probably don't need to have resort bubbles. I'm not sure anybody's going to have anything in place before October 15th anyway. Although the concept of a resort bubble is just conceptually the same thing, having people get a test and be safer and having even more capacity to trace people. I don't know how I feel about wearing a low jack personally, especially since I'm locked into my 9-year-old's room anyway, and I feel like I got one on.
Yeah.
Oh, I thought that teddy bear was yours and behind you on bed.
It is now, I tell you that. They're going to try to fumigate this place like the plague came through it, I'm imagining. The truth is, I think that probably now we'll be able to open, and those will be added layers. So I think the bubble concept will be something that the mayors utilize to their benefit, to add extra safety measures, to add extra testing from partners. Perhaps a resort will say, hey, they're going to also add a second test, which would be great 4 days after travel. Because if you want to know what the perfect plan is, and the perfect is not always possible, the perfect plan is a pre-test within 72 hours of coming to Hawaii and a follow-up test 4 days after. We don't have enough tests to do that right now, and I'm working hard to get us there, but that would be the way. But to get people to travel to Hawaii and to still quarantine for 4 days is not really feasible. If you just want to know the truth, that would mean that very few people would come.
Right.
We will be safe enough if we do the pre-arrival test. We also will respect and validate whatever the mayors want to add on if they want to do extra stuff. And hotels, the market is going to take over real fast, and you'll be able to see it where hotels add stuff, airlines add stuff. I was in a conversation today with one of the major airline carriers, 2 of them actually. They're planning on doing testing at their airports in advance. It's going to be a big announcement next week about that. I've now gotten some other tests approved. So Walgreens, I believe, will be able to come on as another national partner. So everybody's going to be able to do all this stuff so that this will be an afterthought. We're going to be so safe that people are going to be just sick of talking about it. But I don't want to see another outbreak, and I certainly don't want to see another shutdown. So that's why.
Right.
I want to go back to your vaccination comment that you made earlier. Could you tell us about this program? Like, where are you guys at? What do you have envisioned for this specifically here in Hawaii?
Yes. So there's 2 things, okay? I've begun the process. We have a new director of health. I like the old one, too. He's a good guy. But Libby Char is a physician. She's going to help immensely on all these things. There's 2 parts that we got to deal with. We got the flu shots. We got to get everyone their flu shot if they're willing to take it, because you don't want to have flu symptoms and think that you got COVID, okay? And then, if you get the symptoms basically and someone says you got COVID symptoms, you're like me, you're locked down for 2 weeks, okay?
Right.
So you don't want that. So everyone should get their flu shot so they don't have to worry about the flu. Normally only 40-50% of people get the flu shots, it's not 100%. And so we'll have that, and then there's going to be ultimately what happens when we have a safe and reliable COVID vaccination. And we're not there yet. And I don't want to ever expose anybody to any risk at all. So those tests have to be done. Those trials, they have to be finalized. We have to see the safety precautions that have been put into place. And when the state of Hawaii feels that it can validate a safe vaccination, or different companies, 2, 3 of them, then we will make them available to anybody who would like to get them. And what I would like to do, this is just first thoughts, I would like to have a 72-hour window where we make the vaccination available to anybody who wants it in the state. Anybody. So I've already begun reaching out to partners that deliver this kind of thing. I would expect we would do a 72-hour window over a weekend. My team went out, we immunized 33,997 people in Samoa in 2 days. My team did.
Wow.
And we had a bunch of volunteers. That's it. This time we'll have the entire Department of Health at our disposal and the entire health system. And so I would like to do that. We'll finalize those plans. We'll make sure that they work for people. And it would be in the state of Hawaii's interest to invest resources in getting everyone vaccinated that wants it. Again, it's got to be optional because I know there are some people that just don't agree with vaccinations, and that's okay. This is not a time for us to be in conflict with other people that we love just because we have a different ideology.
Mm-hmm.
But I was going to get a vaccination. Now I guess I'm going to probably be immune since I have COVID. But it's important that we do it right. And I'm going to make sure we do it right.
Awesome.
That's an amazing plan. Do you think that it's still going to be a vaccination that we'll need 2 shots for?
I think that's right. I would guess very likely it will require 2 shots. And, in all likelihood, we're going to have something like Vaccination Mondays in the state, where you can go to a lot of different sites that's covered. Maybe it's after work where you have a 4-hour, you just walk in, get it. And that way, because not everyone's going to be able to get it at the same time.
Right.
And there are going to be some groups that are higher risk. I've already begun to compile a list of the groups that should at least be considered to get it first because they're interfacing with a lot of people if they're like medics or whatever, paramedics, EMS workers and stuff. And there's other people in that group, other people at higher risk that we want to prevent the disease in. But yeah, we will do it that way. I think it'll be 2 shots. We'll see. There's, several different companies that are doing it. If there's a vaccination that comes out that's only 1 shot,
right.
Hey, that's great. Yeah. But it's a little bit atypical.
Yeah.
All right. Once again, we have Lieutenant Governor Josh Green on with us via Zoom. Lieutenant Governor, so in regards to that vaccination, I know this will be the last question about it. I was reading this article yesterday, and I don't know how true it is. I mean, it did come from, I think it was a director of the CDC. I could be wrong, but he was saying that he doesn't foresee a vaccination happening till late next year, like October, November of 2021. I don't know once again, what you read online from what I hear is 100% true all the time. But I figure better to go to not just a primary practicing physician, but also the lieutenant governor of one of the 50 states. What do you foresee?
Well, 2 things. I'll be talking to Dr. Fauci in the next couple of days. And then I'm also speaking to the deputy director of the CDC, who's a friend of mine, Jay Butler. And I'm going to get the scoop for us. I know that it's a couple months out, no matter what, at the soonest. A lot of times we do read these things in the paper. There was a challenge. One of the vaccinations ran into one individual that had a side effect called transverse myelitis. And that's a bad one. It caused some damage to the nervous system, causing weakness. And these are the reasons you do these studies. You got to make sure that first of all, was associated with the vaccination and not something else altogether. You have to play it by the book with vaccinations because you're going to give them to a large number of people in society. You can't go around causing new health problems when you vaccinate 100 or 200 million people. You can't do that. So make sure that I'm on top of it. That's all I can tell you. But yes, Dr. Butler and Dr. Redfield's also someone who I know pretty well, who's the head of the CDC. I'll be talking to them and making sure that we have the scoop. I'm also going to go to DC, it looks like in November, to give a talk, and I'll be scheduling face-to-face meetings with the leadership of the country, whoever that is at that point, to make sure that Hawaii is well represented.
Nice.
Wonderful.
Yes.
Now, how is your family doing, by the way? How's your son? How's Sam? How's the wife and everybody?
They're doing great. They're feeling great, and their tests all came back negative. They've got the video game I want stolen from me out there. I can't to get it, so I'm trapped in here with just my vitamins and you guys. But they're awesome people. I love them, and I was so glad they were negative. It turns out, it's going to sound crazy, but tomorrow, assuming I don't have symptoms, I get released by the CDC criteria. I get released from quarantine. I'm going to still stay longer, just out of respect to everybody. I believe an extra week, but it'll be good because then maybe they will not be at risk by being associated with me. based on the CDC criteria. I probably will still spend some extra time apart from them to give them extra protection, but they're wonderful.
Are they still
Well,
sending you food on the little pink cart down the hallway?
Yeah, they gave me some pretzels
Oh,
and granola
Aw.
today. They put me on a COVID diet. I've lost like 6 pounds. They're making me eat granola.
Hey,
oh yeah, you
Lieutenant
can only
Governor
get what
Josh
they
Green.
give you.
Hey, does the state get any free Uber Eats gift cards because they made a killing off of me during this quarantine?
The state should. It's quite ridiculous. I mean, yeah, granola. It's horrible.
Granola. Yeah.
Right on, Lieutenant Governor.
Yeah. Hold on, before we wrap this up, and I know you got to get going. Both Kimmy and I have got our COVID test results,
Yes.
and we thought we would unveil them with you on the show, live on the air, if you don't mind.
I hope they're good results, please.
Okay. You want me to go first, or you want to go first, Kimmy?
You can go first.
Okay. Hold on. Let me open up the envelope here and.
Oh, it came in an envelope.
Yep, they had it mailed to me, FedEx. From the deal. No, I'm joking. I came out a negative. Negative. Hey, hey.
I feel so good.
All right.
Yeah, Kimmy.
Well,
Oh wait, hold on, Kimmy. Let me open your envelope for you.
Please do.
Oh. You got mailed her results too, I see.
Apparently.
Yeah. We're on the radio, theater of the mind, people. Come on.
Yeah.
Well, Joe did point out that I was the closest to you, but I came out negative.
Oh,
Hey!
I'm so
And I have yet
glad.
to take a test.
I was really worried about you guys. Even though I felt that you were negative, you were very smart. You kept your distance, and but we were doing the darn swab of our nose. What are you gonna,
How ironic is that? I know.
I know.
It's in the book. If you want to describe ironic to kids that have to study for their PSATs, that's it.
Yeah.
Get exposed to COVID while getting tested for COVID.
I can't wait till my son has a kid, and then I can tell my grandchildren or child, be like, you want to hear irony? How about you do a radio show with the Lieutenant Governor of Hawaii coming in every Friday as he always does, completely symptom-free as he always is, to talk about this pandemic this is before your time, son, before your time. So we're talking about this pandemic, and we were getting tested for said pandemic, otherwise known as COVID-19. You're reading about it in your history book right now, I know. So anyway, we're getting tested for COVID-19, unbeknownst to everybody, especially the Lieutenant Governor of Hawaii. He was he had contracted COVID from one of his employees, one of his staff members, and then we became exposed to the pandemic while getting tested for the pandemic.
Crazy. Joe, when are we getting your test back, buddy? I hope you're okay.
I haven't even taken my test yet. They're gonna come to my room and do it. Setting that
Good.
up still.
You got a nice room there. I like that.
Oh, that's just the beds. You got to see the rest of it.
Yeah.
Lieutenant Governor, we
like-
call it Hotel de la Fat.
Yes.
That's the story.
that
That's
is
what it says. Hotel de la Fat.
You guys are great. Well, you're champs for including me today. Thank you for that. It's a scary thing for a lot of people. I don't want to ever make too light of it, but the way you're educating people is accessible to them. It's very good. It's important to have a little bit of levity when people are afraid. I learned that as a doc over the years, that most of what you do to get people better is to bring down their sense of concern and their stress levels, and then you just deal with whatever you got to deal with. So thank you for doing that, and we're going to be okay. The new leadership team is actually quite a potent team for the Gov, and we're making things move like way faster, and that was necessary. So count on that, and maybe we'll call in a couple of weeks in a row just so people don't freak. But then I'm going to be the lowest risk guy in the state, probably come visit your show. So that will be fun too. And you calling me when you need me, okay?
Right on, Josh.
All right, Lieutenant
Wonderful,
Governor
thank
Josh
you.
Green on the line via Zoom. Thank you. Get better, and please, whenever you can come by the show, hopefully we'll talk to you next Friday, okay?
Absolutely, 100%.
Take care, Governor, or Lieutenant Governor. Take care.